Hello there. How are you today? That's great. Are you here for your face mapping appointment today? Fantastic. Why don't you go ahead and take a seat and we can begin. Okay? I'm going to first check you in and ask you a few questions. Okay? Alright, if you could please first state your first and last name. Good. Thank you. Alright, and your date of birth. Okay, and it looks like we still have you at this address right here. Okay, good. Alright, so it looks like you haven't had a face mapping session before, correct? Okay, and why were you coming in for a face mapping session today? Okay. So you're worried about some areas on your face here. Okay. Anything else? Okay. Now, do you have any areas in your life that are currently stressful that you're hoping to improve? How is your sleep? Work has been pretty stressful, okay. And your sleep? Usually pretty good, okay. Sometimes, okay, a couple times a week, difficult. Usually around the weekend, okay. Good, and are you currently on any allergy medications? Okay. And do those have any side effects for your face? Okay. We will take that into account. Let me see here. Okay. And what is your diet, exercise, alcohol consumption like? Okay. You're wanting to kind of cut down. Okay, no problem. Good, okay. And how many times a week you would say you work out? Gotcha, okay. Good. Okay, so I think for now, this will be all the questions I have, okay? So now I'm going to do a little assessment of your face, and then we're going to go through our face map, alright? And we'll see what we can find, alright? I will also be doing some light tracing therapy, as well as just some regular face tracing just in general, as it does cause some relaxation in your face, okay? Okay, so I'm gonna get a little bit closer here, alright? Are you comfortable? Okay, great. Alright, so I'll just get right up here, start here, and I'm just going to feel around. Okay. So I would say on your forehead here, so far, and kind of between your eyebrows. Okay. And maybe down on your cheeks. Are you on your cell phone talking a lot? Okay. Let's see. Yeah, this one doesn't look as bad. Do you usually sleep on this side? Okay. sounds good. And are you open to wanting to take any medication for your skin? Okay. Good, and then let's feel right under your chin here. That's where you usually get the most painful ones. Okay. Yeah, that makes sense. Let me see. Okay. Okay. I'm just going to use this little wooden stick here because it can get a little bit more in depth on each part of your face. So good. Okay, and then I'll just feel it's still the most painful. Okay. Good. Okay. Good. Alright, now I'm going to go to the next step and use my light here to look a little more in depth. So, just to get a little bit closer and just look at each spot on your face. Okay. Good. Just to get an overall look. Perfect. That's good. Perfect. Now, any of the spots besides, you said right here was the most painful. Were there any others that kind of stood out? Okay. Sometimes just a couple little spots on your cheek, but that was about it. Alright. Let me see. Good. Okay. I think we can move on to our next step, okay? And we'll just be assessing your situation. So let me get this out. Okay, and so I've made a chart here. Okay, so if you could kind of draw your attention to the chart, you can see that the chin is usually for hormonal imbalances, okay, and kidney imbalances. Alright, so do you think that it could be hormonal? Do you have any other symptoms like moodiness or depression, anything like that that kind of go along when these spots get worse? Sometimes. Okay, that's good to know. So definitely maybe need to do some testing or have you set up an appointment for that. Okay, right. And I didn't see any spots on your mouth that looked like they could be problem areas. Alright, so that's a good sign. Don't have to worry about that kind of sensitivity. Okay, and then as for your cheeks, they could really be a multitude of things. Like you said, you do have talked on your cell phone a lot. So it could be some bacteria or dirt that's just filled that has just made that area dirty. Okay, so you might just need to make sure your cell phone is clean. Okay, it could also be your lungs, liver, stress, overeating, and that could also lead to your stomach. So we might just do some testing unless you're pretty sure that you could rule out those other ones. Okay. Okay. Just let me move this one down here. Okay. So then we're gonna move to your nose. Like I said, your nose also doesn't look that bad at all. I think it looks really clear. All the pores are actually pretty small, so it looks like it's in good condition. Okay, but just so you know, it could be because of poor diet, digestive issues, or poor circulation. Okay, right. So over here, I don't know if you can see, but on your ears as well, that could be due to your kidneys. But after more examination, you can pretty much rule out that your ears don't need anything extra. They actually look really good condition. Okay, so we'll go ahead and move on to your temples and eyebrows. There was some areas that look like that could have been scarring on the sides here. Yeah, so we could kind of look into that a little bit more. Okay, as this could be from gallbladder problems, too much fat in the diet, alcohol, processed foods, and again, poor circulation. Okay, but besides that, I did see a couple, but it didn't look like it was that bad. Okay, I would definitely say the most problem areas are the forehead and your chin, and just a little bit on your cheeks. Okay, so let's go ahead and remove this right here. Put that over here. Okay, so for your forehead, you could be having poor sleep, liver problems, and diet problems, and stress, along with stomach. So, I'm not sure if you know, but our brain is connected to our gut. There are actually more nerve endings in our gut than in our brain. So, anything that we eat or drink or consume is directly affected in our gut, therefore, is directed in our mental health. Okay, so making sure that all of these problems or all of these areas are in best condition that they can be in. Okay, so you said that you had some stress from work. Okay, yeah, and then poor sleep. You said that sometimes you have inconsistent sleep, especially towards the end of the week. Okay, so that could be directly related to that. Okay, and then we got here your hormones. Probably can't really see kidney imbalances just by the way that you've explained the rest of your lifestyle, but definitely hormones could be another indicator, okay, for those problem areas. Alright, and then for your cheeks, it looks like we could really rule out most of these except for the stress and the cell phone. Okay, so with all of these, I'm going to take a little bit of a closer look on those areas, alright? And then I'm going to treat that for you and give you some more information on how we can get your face all cleared up, okay? Alright, so definitely some light therapy is what I'll recommend as well. So I'm going to look here. So this light bulb gives me a different look from the warmer one, so I can pinpoint different areas. Okay, so what are you doing for your stress at the moment? basically just dealing with it. Okay. And you said for sleeping as well. Do you take like melatonin? Do you take any teas at night? Okay. Alright. And as for your hormone imbalances, I'm definitely going to schedule you for an appointment to get some blood drawn so we can see what's going on there. Okay. Alright, great. So before we begin with our light treatment, I want to take your measurements. Okay. So we'll go ahead and pull out a little handy dandy tape measure. So just sit there nice and calmly. So just take a moment. Good. Good. Just the front. Just right there. Okay. Down the cheeks. Good. And then on the other side. Okay. Good. Okay, and then over here. Good. Just do down to this side. Okay. Just go down. Look at that. Good. Okay, and then we'll just do these right here. Good. Okay, good. Okay, perfect. So let me write that down real quick. Alright, so measurements for this. Good. And okay. Perfect. Alright. Alright, so we'll go ahead and we'll start with that light therapy. Okay. So go ahead and close your eyes. I will just be using my little device here and slowly drawing on light on each part of your face. Okay. We'll just gently draw this light around. And this is beneficial. It helps with aging and wrinkles and gets your skin the nutrients that it needs. Good. Good. Perfect. Good. Perfect. Very good. Very good. Great. Good. And then, now that your face is nice and all relaxed, I'm just going to trace different areas on it. Okay. Good. Perfect. Very good. Just going across, and across, and across, and down, and up, and across, and across, and circles around and around. Okay, and we'll go ahead and just spray your face real quick. This is just a gentle mist. And we'll just put it on each side of your face. And I'll just go ahead and rub that in. It's supposed to help calm and soothe your skin. Okay, and I'll make sure to also get that appointment scheduled. Okay, or about this time on this day work for you? Okay, good. Alright, so I will go ahead and get it scheduled, but you will get a confirmation from the lab, okay? And then you'll be able to go in and get your blood taken. Okay, and we'll see what's going on. Alright, awesome. Well, you were wonderful today, and thank you for coming in. So I hope you have a good appointment next week, and I hope all of that goes well. Yes, you're welcome. So you have a great day, and we'll see you soon, okay? Alright, great.